Welcome to 30, Flirty, and Panicking, your go-to podcast for embracing the unexpected and building a life you love. I'm Kelsey, and today's episode truly captures the entire reason why I created this podcast. We're sitting down with Dr. Sekhon. She's a double board certified reproductive endocrinologist based here in New York City. And she's also the author of The Lucky Egg, a comprehensive guide to understanding your fertility and getting pregnant. And with the 30, Flirty, and Panicking of it all, we talk about the timeline pressures that we can feel in different areas of life. And if I'm being totally honest, it is this topic that evokes that panic in me. And it's like when it comes to finding a partner and starting a family, I cannot help but see that ticking time clock in my peripheral vision. And while I work very well under pressure professionally and in many areas of my personal life, when it comes to dating and finding a partner and building a family, that's of course not a space that I want to feel rushed in because I want to get it right. I'm sure many of you feel that way too. But it will happen when it's meant to happen mentality is also met with the reality of biology. And so I think what makes this conversation exceptionally meaningful to me is that it's one that I've avoided for a very long time. I bury my head in the sand because I'm worried I won't like what I learn. But as Dr. Lucky makes so clear, this is a space where knowledge truly is power. And when you understand what we're up against, we can make choices that actually support what matters most to us. So in this sit down, Dr. Lucky walks us through exactly what we need to keep in mind, no matter your age, whether your goal is to have a baby in 2026 or to hopefully ensure that that option is still open to you in 2036. She breaks down the realities of fertility in each decade of our lives. We're talking 20s, 30s, 40s, and sets out what we can realistically do to support ourselves, both physically and mentally at every phase. So whether you or someone you know is looking to conceive either now or in the future, there's something in this conversation for you. And obviously I'm passionate about it because it's highly personal. And I also have the privilege of speaking to so many of you one-on-one each week. And so I understand how deep the uncertainty surrounding fertility runs. And today, I promise that we are not leaving this conversation panicking. We are going to trade the panic in and leave feeling informed and empowered and hopefully excited about what we can do to support ourselves in the future. And as always, I'm so grateful to have you here with me along for the ride. I honestly would not be doing this if it weren't for all of you. And with that said, let's get into it. Dr. Lucky, I'm so happy to have you here today. I think if I could only talk about one topic on 30, Flirty, and Panicking, it would be fertility. And I can't think of a better person to have across from me talking about this than you. So thank you for being here.
Thank you for having me. I have to say, I love the name of your podcast. It does describe a lot of the demographic of patients that I treat.
It's very real. I think we all have these visions of exactly how things are going to play out, the 30, Flirty, and thriving of it all. And sometimes life just looks a little different. And, if we can just acknowledge that, we can actually equip ourselves to build lives we're thrilled about and excited about. So that's the goal. And we're lucky to have you here to tackle a topic that I know, frankly, has been a huge one for me. It's kind of this thing that's always lingering right here and on my mind. And I know that that's the case for so many of the people in our audience. So before we get into all things the Lucky Egg and all of the takeaways we're going to share, I would love to give you a chance to just set up a bit about who you are and what you do and your path to where you are right now.
I would love to. So I'm Dr. Sekhon. I'm a double board certified OBGYN, and I'm an REI, which stands for reproductive endocrinology and infertility expert. Doesn't exactly roll off the tongue. But what that means is I help people tackle, first of all, diagnose and get to the bottom of why they might be having trouble with their fertility. And also those who are just trying to plan it all out for the future. Maybe they're not ready right now, but they want to understand how they can best plan around their biological clock. So I would say 50% of my practice is egg freezing, embryo freezing. The other 50% is educating people about fertility, as well as helping them to identify the barriers and overcome them. I'm based in New York City. I work at RMA of New York, which is a large practice. And more recently, I have become the author of The Lucky Egg, which is poised to become the fertility Bible. It really has everything one should need to know about their body and how it works and how to prepare for trying to get pregnant, how to navigate finding a clinic and a doctor that can help you and when to do that if it's not going as planned. and then what testing you really need, because there's all of this noise on social media, in particular online, and people feel like there's like 50 million things they need to be thinking about and doing. And I try to really simplify it and make it easy to understand and help people understand what are the high yield things that I actually focus on or care about as a fertility doctor. But hopefully I pulled this off. I feel like I did. I do it in a way that makes them feel like they're talking to their friend. And it's almost like having me in the corner as your scribe, taking notes or providing you with a list of questions to ask. But then there's also this whole thing about treatment and when treatments aren't going as planned, because, that can be a road that many people encounter, how to troubleshoot. And the biggest thing about it all, and it's infused throughout the book, is how to protect your mental health and really bolster your resilience, because so much of the fertility journey for so many is a marathon, not a sprint. And it's all about how to stay in the marathon until you get to the finish line.
Yeah. And beyond all of your, professional credentials and accomplishments, I feel like you're in a really unique position because, as you've touched on, you also have been on the other side of things. You've experienced IVF. And to your point, the mental toll that it can take is very significant. And just the journey, no matter where you are in your fertility journey. How did having your own experience with IVF kind of affect the way that you approach your work and the way that you communicate information to people?
It had a profound impact. So, for anyone listening that doesn't know the backstory, Um, there's not a ton to know, but it was just something that a lot of people, especially in their 30s, are confronted with, planning around the biological clock. And I'd already had my daughter, who's now 8, and I was thinking about how difficult, I didn't anticipate how challenging it was for me personally to balance being a new mom and my career aspirations. I had her when I was still in fellowship training, about to finish, and then becoming a subspecialist and starting to manage my own patients. And I knew it was very important to me to prioritize my personal life and my personal goals, but also to keep striving and doing the things that are so important to me professionally and helping couples. And so basically, I made a decision to freeze embryos with my husband. And I thought going into it, I was actually quite cocky. I thought, I know everything there is to know. Obviously, I wasn't treating myself. I went to a colleague that I know and trust within my practice. But when things didn't go exactly to plan, and it took several cycles to get what I needed to freeze to feel confident about the future, and because of diminished ovarian reserve, I had a cycle canceled because of lack of response. I had a cycle where I got 2 eggs at retrieval and nothing turned into an embryo. And it just felt like, wow, the experience, it's one thing for me to talk to patients who are going through this and explain and rationalize and intellectualize, the why behind it all. But it's another thing to actually inject yourself day in, day out for 8 to 10 days and to have nothing to show for it.
Yeah.
And that really rocked my perception of everything. It changed the way I speak to patients. I always was a compassionate doctor, but now that I've actually been on the receiving end of those updates and those phone calls and know how distressing it can actually feel to not have any control, it really shifted my perspective in a way that it's hard to even articulate, but I definitely wrote with that lens, and really tried to put myself in the shoes of the patient in every scenario I describe in my book. Um, I also think that it led me to prioritize discussions around mental health more than ever. And that is very much the theme of the book: mental health around diminished ovarian reserve, low response, or, pregnancy loss, or navigating needing to pivot to using donor egg. There's so many different unique aspects of how these different types of problems can impact us mentally. And I really wanted to not just kind of give blanket statements about prioritizing self care, but really talking about specific issues and how they can make one feel based on my experience treating patients who have navigated so many different types of challenges. So, if I, a doctor in the know, felt blindsided by how I emotionally felt and how it affected my mental health, it just drove home the point that this discussion about mental health is needed for everybody, especially those who aren't experts and, on top of everything, don't really know what to expect or feel lost in the shuffle. It's important for them to be emotionally and mentally supported so that they can stay in it to win it, so to speak.
Yeah, absolutely. And you just talked about kind of going in feeling a little bit cocky. I think there are so many misconceptions. What are some of the biggest misconceptions that you think people head into the fertility process with?
I think a huge misconception is feeling like the science is so good that everything can be overcome.
Mm.
I do think the science has gotten really great, and we're now at a position where when people do IVF and are able to create a healthy embryo, there's a very high chance of success, but it's not 100%. And we have to be realistic. There is this mentality of, okay, well, now I'm bringing out the big guns. I'm moving on to IVF, and that's going to solve all my problems. Or because I created embryos as part of fertility preservation, or I froze my eggs, that's going to negate the biological clock and everything is kind of surefire. And I think it's important for people to realize human reproduction is inefficient. And even with the best of technology and all of the know how, we're still confined to working within that inefficient framework. And so nothing can ever be 100% or perfect or a guarantee, but it's all about understanding the stats and having realistic expectations and using those realistic expectations and making informed decisions like what I did when I went through a cycle. I had to do it multiple times to get to where I needed to go and where I wanted to end up to feel confident about the ability to come back and use what I froze in the future. And it's important for everyone to have those informative conversations. Sometimes one of the things I see a lot when I speak to patients and maybe they went elsewhere for treatment, they don't always get the most holistic view of everything. Or maybe they're focused tunnel vision on, I just need to freeze my eggs. But we need to be having discussions about what happens if and when you come back to use your eggs and really giving people the information and knowledge so that they can make smart decisions now that are timely.
Yeah, absolutely. And I think obviously with the 30, flirty, and panicking of it all, timeline is a topic we talk about a lot. And I will say in so
Hmm.
many areas with people who are absolute experts in their crafts, they'll say things along the lines of like, things do happen as they're supposed to. And I think that this
Hmm.
is one of those spaces where that's actually not necessarily the best advice. While there are some spaces that might be true about, there are things that actually we should really be doing at various phases of life. I mean, if I'm being completely honest, I don't think I raised the topic of wanting. I mean, I've probably known since I was a little kid that it was important to me to hopefully one day become a mother. But I don't think I ever asked
Hmm.
a doctor about it until I was engaged and felt like that was
Hmm.
right around the corner. Right. And I think it's also something that we can kind of burrow because you are scared of the information sometimes. So I would love to just chat through
Absolutely.
for the 20 something year old, for the 30 something year old, and for the 40 something year old, what we should be considering. For the person who's in their 20s, maybe, and isn't ready to have a child yet, but knows that that's important to them, what should they be keeping in mind or asking about?
So I think it's just about having an awareness and not ignoring things or over normalizing certain symptoms. I think my hope is that everyone in their 20s will look at my book as Health Class 2.0 to
Yeah.
fill in the knowledge gaps and give them necessary information that wasn't really pertinent to, when they were teenagers and going through Health Class 1.0, where the goals were very different. It wasn't about what to know about ovulation and what your biological clock all means and how to prepare for pregnancy. It's all about prevention, right? Which is important, but you lack the emotional maturity, the maturity in general and sophistication to understand some of the more complex things that everyone should really know about how their body works. All too often, I'll see women sometimes, at their late 30s or even in their 40s for the first time to just talk about fertility and kind of fill in those knowledge gaps. They're not trying to get pregnant. They just kind of want to know what they need to know because they've heard peripherally there is a biological clock. And there will be fundamental facts about how your body works. The fact that a bunch of eggs come to the surface and it's like a lottery. Your brain sends a signal and only one of those gets selected to be the one to ovulate and the rest of those other ones get thrown out, right?
Right.
That is an important fact that a lot of people don't know, that magical process is just kind of happening in the background in their bodies. They'll assume things. They'll say, oh, I ovulate alternating on left and then right and left and right. I'm like, no, that's not how our body works. It's messy. Biology is messy and random. And so I hope everyone in their 20s starts understanding those things, even if it's not pertinent to their life, even if they're not needing to start tracking ovulation because it's not that they have a partner right now or they're even in a place where they're able or willing to start trying to get pregnant. It's still important. It's important to understand and look at your period as your fifth vital sign. Vital signs as doctors, we think about as like blood pressure, pulse, temperature, but think about your period as a reflection of what could be going on in a deeper way, right? Is it painful? Could you have endometriosis? It takes an average of 8 to 10 years to get diagnosed with endometriosis, which is a major gynecologic issue that it doesn't always, but it can predispose to infertility. And if left unchecked for years, it can get worse and it can really detract from your quality of life. And too often people will say, yeah, but this is just like what all women go through, right? Or this is how all the women are in my family. It's just normal. But having such a painful period that you're missing work or not able to attend school is never normal. And especially if someone says these things and says, I went on the birth control pill and then, my pain went away, that's a telltale sign that you might have a condition like endometriosis. What about irregular cycles? Polycystic ovary syndrome is a very common condition that affects at least at a minimum 10% of women. And it can lead to not only irregularity in your ovulation, where it gets harder and maybe more inefficient when you do think that you're ready to start trying. You don't know when to try because you never know when your ovulation is coming. And it can also cause metabolic issues, predispose you to things like diabetes and high blood pressure. So these are important things to know, not just about your fertility, but for your general health and your well-being. So it's really important to seek care and help and get answers. And if you don't get answers from seeing one OBGYN, feeling empowered to see a second one or a third one, and not settle for, feeling confused about what's going on with your body, and, not insisting on getting answers now. Even if it's not relevant in terms of trying to get pregnant, it could be relevant to your quality of life and your general health and your future fertility. So in your 20s, if you're not ready to start trying, those are major things to think about. I think you don't have to go off of the pill if you've been on the pill for a long time just to know what your body can do, because that's also putting you at risk of an unplanned pregnancy. But I get asked that a lot by my 20-something-year-old patients who come to me for what we call fertility checkups. But it is important to know if and when you do get off the pill that it may take, 3 to 6 months to get into a regular pattern. But tracking your cycle, keeping a menstrual diary, even if it's on your phone, there's many apps that can kind of give you prompts of what to be recording and when. But that objective information can help your doctor spot patterns and things that we want to call out. Now, if you are partnered or you're someone who knows that eventually when you are ready to have kids, you're going to use donor sperm, whatever the issue is, I think it's important to think about your timeline and think about, when do you think realistically you're going to be in the right time frame of your life, whether it be due to career, partner, or lack thereof? When could it be realistic? And if the answer is more likely than not, I'm going to be 35 and older when I'm trying for baby number one, or maybe even baby number 2 or 3, if you decide you want to have a bigger family, it's so important to be aware of the biological clock and what it means, right? The fact that as we get older, because we're born with all the eggs we're ever going to have and we don't make new eggs or repair our eggs, it can get a little bit more challenging to rely on randomly ovulating that healthy egg that has a good chance of turning into a healthy pregnancy. And so because of that, it may make sense to have a conversation or at least explore the option of things like egg freezing or embryo freezing. Embryo freezing, if you have a partner or you're going to want to use donor sperm, there can be some benefits to going a little bit further and not just freezing them as eggs, but turning them into embryos, because not every egg is capable of turning into an embryo or a baby. And so these are things to kind of talk to your doctor about. And my advice is, because I've heard a lot of bad advice over the years by proxy, if your OBGYN says something along the lines of, well, you're so young, you don't need to worry about that yet. Or, oh, you're dating someone, so maybe you guys will get married soon and then start trying, so you might not even need to consider. That's bad advice, in my opinion, because you should make your plans and your strategy contingent upon you. That's always going to be a more powerful place to come from. And I don't think it's good to tell people they don't need to worry. I think the earlier someone does consider something like egg freezing, the best age is really in their late 20s, early 30s, because you're still at a point where not a lot has changed with your egg count and quality for most people. That's the pattern most people follow. But you're also at a place where you're more emotionally mature and able to do all the things that would be required of you if you decide to move forward with that step. But those are kind of the big things in your 20s I would think about. In your 30s, it's really about more or less the same thing, but being really serious about your timeline. And in your 40s, even if you haven't started trying, I think it's never too early to have a conversation with a fertility doctor, just because we know things are moving more rapidly with the biological clock at that point.
Right. I just had a guest who is in her 40s and was extremely open about the fact that she knows that motherhood is part of her journey, but she is not in that place. And I think, I saw some emotion from her in talking about the fear that it could possibly be too late. What would you say to anybody who maybe is in their 40s and has had that intrusive thought cross their mind?
Yeah. I mean, I think it's important to understand what the challenges are, right? So I mentioned that every cycle you have a very limited subset of the total number of eggs from your stockpile because you're born with 1 to 2 million eggs. So most people, regardless of what they're told about their numbers, they have a lot of eggs. They just aren't all accessible at the same time. And we rely on your body to serve up whatever number it can. And it's going to be a reflection. It's like rationing. It's going to be a reflection of how many are in your resting pool. And throughout our lives, we're losing eggs all the time. We tend to lose them at a slower rate in our 20s and early 30s, and then that speeds up as we get past our mid 30s. Now, when you think about the things you can assess, the thing that you can really test in an individualized way on a person when they come in to see an expert like me is their egg count. And I only care about your egg count if you're ovulating on your own regularly, you get a period every month. It means your egg count is above a threshold where your ovaries are able to function. But why do I care about your egg count? If you're considering egg freezing, embryo freezing, or we need to consider IVF to help you overcome a variety of causes of infertility, that tells me how many tools I have to work with. In one round of effort of IVF, how many eggs could I potentially extract from the ovaries? Because I can only get to what your body makes available. But otherwise, your egg count doesn't tell me anything about your fertility, because your fertility is defined as your ability to get pregnant from ovulating an egg. And everyone is on a level playing field when it comes to ovulating one egg at a time for the most part. So it's more about what is the chance of ovulating a healthy egg. And that's where age comes in. There is no direct way to test one's egg quality or probability of ovulating a healthy egg in a given month. But we make a guess, and it's never perfect for anyone. So if anyone in their 20s is listening, don't be offended by this. This is our biology. There's a 20 to 25% chance that if an egg gets fertilized by sperm and grows into an embryo a week later, if we were to test that embryo, 20 to 25% chance it might be missing or have extra DNA. It doesn't even have a chance to implant. If it implants, it could result in a miscarriage. That can happen to anyone at any age. Now, by the time we get to 40, there's more like a 60 to 70% chance that an embryo could have those errors. Now, that sounds scary and bad, but remember, it was never 0%. It was never 0%. Anyone can ovulate an egg that has a typo, and these are common in nature. It's part of human reproduction. It's part of our biology. It can happen in your 20s. It happens to a greater degree as we approach our 40s and enter our 40s. So what does that mean? It might take several cycles of randomly ovulating an egg for it to be the right egg and for it to actually get to where it needs to go and implant. And that means there could be a higher risk of things like miscarriage, because the number one driver of miscarriage is that an embryo formed that had missing or extra DNA from a typo inherited from the egg, because we don't have repair mechanisms and over time they break down. But remember, I didn't say 0% of embryos are going to be normal in your 40s. And that's what a lot of people assume. They're like, oh, all my eggs are bad. You still have the ability to ovulate a healthy egg. And the reason I called my book The Lucky Egg is because there is sometimes it's impossible that you don't have a crystal ball. We don't know, if someone comes to see me just to have a conversation at 40, they haven't even been trying on their own. I don't know for a fact that they're going to have fertility issues, because there is some element of serendipity and luck. You got to do all the right things. You have to show up as the best version of yourself, and you need to be aware and informed and not waste time. But to a certain degree, we can't control whether the egg you ovulate in a given month is going to be healthy or not. Now, there's odds, and your age plays into those odds, but you still have the ability to get pregnant without my help, even in your 40s, is the takeaway, right? And it's important for people to realize that you're not a stat, you're not a number, you're more than your age. And even at 44, 45, people can ovulate a healthy egg. Now, it starts to become fewer and far between, which is why we say don't wait longer than 3 months of trying in your 40s. Go see a fertility doctor, because we want to be really proactive and mindful of the biological clock.
Right. I think I just heard a sigh of relief from many people on the other end of this conversation. For somebody who is 30 years old, right? The book literally walks us through how to get pregnant. It's January.
Yes.
We have a new year ahead of us. For somebody whose goal is to become pregnant in 2026, can you walk us through what we should be doing right now. What are we doing to prepare for that,
Yes.
to set ourselves up for success?
Okay. I'm just going to walk through the sequential steps. So if you're on birth control, you have to get off of it, duh, right? But you got to start tracking your cycle, and you may need to accumulate 3 or 4 months worth of data to really understand what your pattern is. If it's a fixed pattern, let's just use this example, even though we know women are all built differently, and 28 days is not what everyone's cycle is, but let's just say it's 28 to 30 days, 28 to 30 days. You can start to plot out, and I have a lot of content on my blog about this, and especially in the book, about how to track your cycles, because there's lots of different ways, and you can layer the different methods on top of each other to increase the accuracy and confidence that you have in pinpointing when your next ovulation may be. But the first step is seeing, is it a regular interval? If it's not, then you fast track straight to see the fertility doctor. Because if you don't know when you're ovulating, then you're not really in the game. Because when you ovulate an egg, it only lasts for 12 to 24 hours. If it's not fertilized in that time frame, you have to wait till the next ovulation. It doesn't last. It doesn't have a long shelf life. Sperm can last in the reproductive tract for 3 to 5 days. You really want to line up your attempt ideally in the 2 to 3 day window leading up to ovulation. So if you're not sure when that is, go straight to the doctor. Don't wait and waste time. But if you do know when that is, start tracking your cycle. That could be the calendar method where you're plotting it out. A lot of apps will do this automatically for you, but you're able to say, okay, I usually get my period at this point, and so I can count back 14 days from my anticipated next period to pinpoint when I'm probably going to ovulate, and then isolate my attempts to that 3 day window in the lead up. You can also pee on a stick called an ovulation predictor kit, which will pick up the signal your brain is sending to get you to ovulate. And so it's just another sanity check to say, okay, this is all making sense and lining up. Then you're also in anticipation of being ready to do this step, ideally even 3 months preconception, you're getting on a prenatal vitamin. And that prenatal vitamin should have folic acid, because that's going to help prevent a certain type of birth defect, which can happen if you're not consuming enough folic acid. So being on prenatals, thinking through even before trying to get pregnant, am I up to date on my health surveillance? Am I up to date on pap smears? If you're in your 40s or you have a family history and you're younger, maybe that looks like getting a mammogram to make sure that you have a clean bill of health and you're up to date on all of the different types of cancer screenings we know about, checking thyroid function, really just making sure you go to your primary care doctor even and say, like, are all the things that, I've been dealing with and working on with you, are they as fine tuned as they can possibly be?
Right.
If you have PCOS, if you have known insulin resistance, a strong family of diabetes in your family, if you're dealing with, trying to lose weight and it being difficult, those are all things that you may want to look into more deeply with your doctor, whether it's your OBGYN or primary care, to identify, is there a way to make you more sensitive to insulin? Because insulin resistance is a very common problem that can set you up for a harder time getting pregnant. It can alter egg quality and resulting embryo quality. It can make you more prone to those errors we were talking about. It can make it harder for an embryo to implant. It's just not as conducive of an environment. So really and truly, it's like the common sense things that are better for heart health are going to be better for fertility. So never smoking, trying to keep alcohol intake to a minimum, less than 4 drinks in a given week, is what's correlated with better outcomes, whether trying on your own or with the help of treatment in the majority of studies out there. Mediterranean style diet is the healthiest diet for heart health and fertility. That's a really simple, it's a delicious diet. It's like
Yeah, I
naturally
love
what I
that.
gravitate towards
Same.
it's eating all the colors of the rainbow, and trying to have lots of protein that's, healthy and lean, and not shunning carbs altogether, but going for whole grains and really trying to do things that are going to keep you full for longer and really provide the nutrients that optimize you for a future pregnancy. Those are the big things, and they're not sexy, because usually when it comes to medicine and biology, the real answer, the answer that you actually need that's going to help you, is not sexy, but it's common sense. And I think the sum of small changes and efforts day to day can create an environment that is more conducive to getting pregnant, staying pregnant, and setting you up for a healthier pregnancy and eventually a healthier child moving forward. And we can't forget the role that men play in all of this. This is not advice isolated to the female partner. Men make new sperm all the time. So there is this conception that they're immune to all of the things that we know can negatively impact fertility, but that's not true. And even more so for men who are always making new sperm every 74 days, there is a target that we can be treating and addressing and trying to improve lifestyle changes to produce healthier sperm that will be associated with a better quality fertilization of the eggs. And the male genes help to form the placenta. And so that can set a pregnancy up for a lower risk of health complications. They have linked the health of male partners with things like morning sickness, preeclampsia, high blood pressure in pregnancy in the female partner, and also with long-term chronic health conditions in future children. So maintaining a normal, healthy weight, controlling chronic medical conditions, not doing any of the toxic things that we talked about in terms of lifestyle, that all applies to men. And it's really important for both partners to be focused on that.
I know, and I think that that flies under the radar quite a bit, so I appreciate you calling that out. For the women who are in this group that we're discussing who are looking to get pregnant, in their 20s, 30s, or 40s, can you walk us through if you have begun trying and you're doing these things and nothing has happened, at what point in time you should seek additional help?
So fast track without even trying. If you have really painful, debilitating periods, they got better once you went on birth control. That's a reason to just get baseline imaging and get a fertility checkup from the get-go. If your cycles are irregular or if they're very, very heavy, that could signal that maybe you have issues like fibroids, which might not be a problem, but depending on the location and size, it's not standard for everyone to get a pelvic ultrasound.
Yeah.
Usually this is called a transvaginal ultrasound. And I talk about this a lot. It's kind of controversial because it's not a public health recommendation that every woman in their 20s or 30s gets one. But personally, that's what I would tell any friend or family member before trying. I would want to get one, especially if you have any of those red flags, because it can tell you a lot that just going off of symptoms or a feeling can't. It's more objective to be able to actually look at the uterus and look at the ovaries and kind of spot big problems before they can become even greater problems. So I think, it's important to know when to fast track, and those are things to really look out for. But if you're in your 20s and you've been trying and it's been at least a year, it's time to go seek expert help. Even if your OBGYN has done preliminary testing and everything comes back normal, don't wait longer than a year, because 85% of couples should be pregnant after 1 year of regular unprotected sex timed with ovulation. Now at 35, we say don't wait longer than 6 months because of everything we talked about when we think about how age can impact our egg count, which is important if you should need IVF for any reason or need to do an egg retrieval. But also more importantly, your egg quality, your ability to ovulate a healthy egg. So don't wait longer than 6 months. And if you're 34 and on the cusp of your 35th birthday and it's been 6 months and you're anxious about it, I don't think that it's too early to have a conversation with a fertility expert, especially if you're someone who wants to have 2 or more children, right?
Right.
Because you want to think about the big picture timeline. And at 40, like I said earlier, I wouldn't wait longer than 3 months of trying. And I don't think it's wrong or too preemptive to talk to a fertility doctor even as you start trying.
You also talk about kind of, for those who are parents, having conversations with our kids. Obviously, it's case by case, and each parent will make the decision that's right for them. But what kind of conversations should we be having when we're talking about next generation? I think teenage years approach, and that's the first time this topic comes up for many people. What are your thoughts on that?
Well, I think it's interesting to see the shift because I have an 8-year-old and a 5-year-old now, and my 8-year-old is in second grade, and she is, already in science, learning about the science of reproduction. And I actually was invited to come in and talk about the science of reproduction and show them some cool videos of the things we do in the lab, which in a way was an easier way to have the conversation because it took the sex piece out of it, right?
Yeah.
It was like, let's talk about the sperm and the eggs and where that all comes from and how it all works. I think it's good to normalize the conversation early. And I don't think it necessarily has to be in the context of IVF, but I think even coming down to naming body parts correctly, growing up, that wasn't my experience. It was like every body part had this like nickname or, there was like a code for it.
Yeah, exactly.
And that sends a message to the newer generation that says your body is a source of shame. We cannot name the parts correctly because it's like a dirty thing. It's wrong.
Right.
And I think that's led us to the position we're all in now, which is a lot of us not thinking about our body parts and all the things that we really should know about our reproductive system until we're actually trying to get pregnant. And I think then it's really overwhelming to say, now I have to fill this huge knowledge gap. And I think you start out simple, just normalize talking about body parts and our reproductive systems. They don't need to know all the nuance and detail, but I think it's a conversation that should be kind of ongoing and open so that people don't feel ashamed of their bodies. They don't feel like it's a dirty word to say vagina or penis. And they're more apt to ask questions and have open discussions and dialogue, which at age appropriate intervals will continually broaden their knowledge and allow them to arrive to their 20s with much more context, less shame, and less fear around their bodies and how everything works. And then I do think every 20-something-year-old woman, I hope, reads my book, because I think that it is like Health Class 2.0, and I think it can help to kind of give them the appropriate context in a non-fear-based way of, yes, let's acknowledge our differences. Men are always making sperm. We do not have that same system. We have to think about how the biological clock affects us and acknowledge there's a whole part in the biological clock chapter that talks about the biological clock that men have that 99% of people I speak to in my clinic when I'm seeing new patients have no idea about, right? So we should be educating both sides and making sure that they understand, what their body parts are, how it works, and what are the issues, especially when it comes to age and our fertility, so that people, and also to let them know, hey, there are things that you can do. Not everyone is going to be told they need to freeze their eggs. But I think that would be a really useful information at an early age to normalize the conversation around biological clock and fertility preservation, and giving women, young women, knowledge and context that, hey, there are things that are out there. They're not surefire. Nothing is ever a guarantee. But the earlier you do explore those options, if it's something that is important and resonates with you, the better the outcome tends to be.
Yeah, absolutely. Dr. Lucky, I want to be mindful of your time. In addition to getting the book, which is out now, the link is in our show notes. So everyone run to go grab that. It really is the ultimate guide. There's one piece of information that you can leave listeners with today. What would you like that to be?
I want people to know that whatever challenges they might be facing, if they're currently listening to this and maybe they tried to freeze their eggs and maybe they, like me, experienced a cycle that was, less than what they were hoping for or expected, or maybe someone's going through infertility or has had losses. I want you to know that your body's not broken. This is not your fault. Your worth is not determined by your fertility or by, your lab test values. You are whole just as you are. And this is not something that you should be ashamed of or blame yourself, and know that you're not alone, right? I think that we are improving in terms of having dialogues like this, and thankful to social media for creating these beautiful online communities for people to feel less alone. But trust me when I say this, and I think about this all the time when I'm taking the subway home from work. You never know what other people are going through.
Right.
And don't ever assume that you're the only one grappling with this. And especially we as women do have to really band together. I mean, I think about this all the time, that we've kind of been tasked as a generation with this impossible balance to strike. It's so grateful. I'm so grateful that compared to my grandmother and even my mother, I had more opportunities in my life, career-wise, education-wise, to be on equal footing with men. But as a result, it also created a conundrum where even though it is very important for me to have a family, it's taking longer for us to be financially independent. And thankfully, we are changing our narratives around relationships. So we are expecting better. And so we're waiting maybe longer to find the right person, if we want to do this with a partner, to do it with. And all of that has led to the situation where now we're coming up against the biological clock. So for us to not have formalized education around this, I feel like in a lot of ways, we as women have been set up for failure. And I want people to realize that this is not their fault. We're finding ourselves in a very difficult position where we're magically expected to do this 180 shift and know all the things that we need to know and figure it out in the right time frame and focus on the right things, and also overcome biological realities of what it means to get older. And I think it's unrealistic for us to do this alone in a vacuum. So that's why I wrote this book. I'm so excited for everyone to have access to it.
Me
I'm
too.
on Instagram and I keep, making content and sharing information there too. But we all have to rely on experts. And as experts, we really need to step up to the plate and make sure we're providing good information and drowning out the noise so that people can make informed decisions that are rooted in evidence And really and truly, I think giving mental health support and having conversations like this is what's going to change the game and help future generations not find themselves dealing with that same struggle.
Yeah, absolutely. And I'm so grateful to you for just bringing us that peace of mind. To your point, knowledge and communication are kind of the keys here, and the book really is such a strong guide. So thank you for doing that.
I'm Dr. Lucky Sekhon. I'm a fertility expert. I'm the author of The Lucky Egg. And I hope that after listening to this episode and after reading my book, you're all going to feel 30, flirty, and confident about your reproductive future and the choices that you choose to make.